So Rusty is diagnosed with a recurrent glioblastoma. A glioblastoma is a type of primary brain tumor, meaning that it's a brain tumor that arises primarily from the cells of our nervous system. We don't have a cure for glioblastoma, but we have therapies that prolong the quality of life and overall survival for patients. But what we really are searching for is something that is going to change the paradigm and be a game changer for these patients in terms of changing this disease from something that is a quality of life issue to a cure.
We were considering doing a standard reoperation on him, but we do have this new clinical trial, which he is a great candidate for, and Rusty, being Rusty, is game for that and likes the possibility of doing something new and very innovative.
I credit Dr. Kelly with saving my life. I sometimes say to myself, if Dr. Kelly said, go jump off the pier, I'd go and do it.
I'll have to talk to him.
This particular trial, the Medicenna therapeutic trial, use a protein that is targeted to something that is present on the tumor cell, in this case an interleukin receptor, that isn't present on normal cells. And that way the therapy will get only to the tumor cells and not affect the normal brain. There is a Trojan horse aspect to it.
Now, in Rusty's case, he was an ideal candidate for this type of approach.
Dr. Kishri said to me, which I think is really funny, he said, "You're the first patient I've ever had that's been excited about having surgery."
Doctors here at Providence St. John's Health Center offered Rusty the chance to become the first West Coast patient to test a new way to attack this cancer.
This is where the catheters were placed.
Dr. Achal Atral and Dr. Santosh Kesari carefully mapped out the tumor. They made 2 small openings in Rusty's skull and used a catheter to directly deliver the medication to the site.
Every single cell got delivery of the drug using the MRI guidance.
The goal is to bring an extremely toxic drug directly into brain cancer cells. To do this, researchers use a bioengineered fusion protein called mDNA55. It binds to cancer cells, and it's brought in just like a Trojan horse.
Once inside the cell, it releases this toxic payload, so it tells the tumor cell to shut down and stop functioning.
It'll be a few months before researchers can tell how well it's working, but seeing Rusty back to normal activities so quickly after the infusion is a good sign.
We're all hopeful that this is going to help him survive longer than the average person would.
Rusty can't wait to get back to the beach and start paddleboarding again, and he's thrilled to be leading the way for other patients.
I know I'm trying to help myself, and I'm trying to help other people too.
I'm going to get these out Wednesday, right?
These stitches are what's left of a brain cancer treatment 76-year-old Rusty Doms underwent 2 weeks ago.
Not only are we getting the bulk of the tumor that we see, but the drug is actually infusing into the rest of the brain, where we see the single cells that are intertwined infiltrating into the brain.
Early results are promising. At 1 month, Rusty had swelling, but at 2 months, his MRI showed tumor shrinkage.
You know, I feel good, and one step in front of the other and a positive attitude.
Not a lot of exciting things happen in the cancer world. So when there is a moment for when we can be really excited about something that involves potentially them getting better, I'm not going to hold my dad back ever.
We know that the best is being done for us, and we're perfectly fine with that. We can't ask for any more than that.
I think it gives him tremendous hope, as he has said, and gives us even more motivation to push the field forward as much as possible, as quickly as possible, and to get these innovative treatments to our patients.